everyone. We're here today with another NLN Nursing Edge Unscripted podcast. We have a great one for you today, one that is of interest to me. So today's topic, we're going to talk about a very successful simulation consortium that we have here in Maryland, and it is called the Maryland, help me out, Sabrina.
Maryland Clinical Simulation Resource Consortium.
It's a mouthful.
MCSRC.
We're going to call it MCSRC. I'm going to have to refer back to that, which I was familiar with quite a few years back. And, having worked in New York and had a simulation center, I know that we had tried to form a consortium. So I know there's a lot involved in creating a consortium. And again, you've been around for a long time, very successful. So we want to learn more about how do you put a consortium together, and tell us a little bit about your MCSRC. So I'm going to start with, before we get into the discussion, I'd like you to introduce yourselves. So for those of you who don't know me, my name is Kelly Bryant. I'm the director of the Center for Innovation and Education Excellence at the National League for Nursing. And Sabrina, could you tell us a little bit about yourself?
Sure. My name is Sabrina Baraz, and I was the original faculty lead for the MCSRC, was full-time faculty at Montgomery College, and then had moved on around 2019 to do work as a sim educator in educating people inside and outside of George Washington University. And now I am kind of freelancing and do a lot of work with NLN as a simulation consultant.
Yes, you do. And I appreciate the work that you do with us at the NLN. Jaslyn, I'm going to pass it to you.
Sure. Hello, everyone. My name is Jaslyn Moreno. I am the current faculty lead of the Maryland Clinical Simulation Resource Consortium. Kelly, by the end of this podcast, you're going to be able to roll it off just like that.
I don't know. I'm off to a rough start, but
I had the privilege of working with Sabrina at Montgomery College, and she mentored me into the role of faculty lead.
Okay. And also, you forgot to mention, you're also one of our consultants here at the NLN.
I am. You're right. Yeah, I do get to work with Kelly and Raquel over at the NLN.
And last but not least, Monique, tell us a little bit about yourself.
Hello, everyone. I am Dr. Monique Davis. I serve as Dean of Health Sciences and Director of Nursing at Montgomery College. And I'll just go ahead and start off by sharing how the consortium began. So in 2014, the idea came across the state with our previous director, Barb Newble, had worked with the Maryland Higher Education Commission Nurse Support 2 program coordinator. Her name was Peg Daw. And the two of them had a conversation about the state of Maryland needing some guidance and support and funding and equipment and materials for simulation to streamline it throughout the state. So in 2015, we were awarded just a little over $3 million. And those funds came from the Healthcare Cost Review Commission. So the state of Maryland is the only state in our country that requires hospitals to provide 0.1% of their revenue to nursing education. Part of those funds go directly back to hospitals to fund their education programs, nurse residency programs, things like that, their competency fairs and things like that. The other percentage of those funds are directly spent through the Nurse Support 2 program. And so at the time, there were 23 pre-licensure programs, and we're able to submit grant proposals, and it's a competitive grant process. However, the Maryland Clinical Simulation Resource Consortium, affectionately known as MCSRC, was a state initiative. So the $3.1 million that we received for the 5 years from 2015 to 2020 was a direct fund source for Montgomery College to be the host site to offer simulation education and best practices, and then simulation equipment and materials. Over the first 3 years or so, we did a evaluation or assessment across the state with those 23 pre-licensure programs to see what equipment they already had. And Sabrina Baraz was very instrumental as the faculty lead in going out and doing those on-site assessments, as well as developing the curriculum for the trainer-trainer program. So we call them simulation education leaders, and they have 3 different levels that they can complete. I'll let Sabrina and Jaslyn talk a little bit more about the faculty training. But also in those 3 years, we provided funding for the schools to receive an adult mannequin, a birthing mannequin, a toddler, and a newborn mannequin, so that all the 23 schools across the state would be streamlined. In 2020, we had this wonderful experience called COVID, and our world came to an immediate halt. And the need for simulation and the need for virtual activities just skyrocketed. So I'm sure Sabrina and Jaslyn can talk a little bit more about the work that we did in that space and offering forums and helping the schools to integrate virtual simulations and just offering faculty support during that most difficult time, because we were all trying to figure out how to get this streamlined. Also, during that time, the state of Maryland opened up some additional nursing programs. So to date, we have 30 pre-licensure programs in the state. All of the schools have received a Pyxis machine. It was streamlined across the state. And now we're working on virtual reality goggles and the software that goes with that. So not only are we providing what's necessary for education, but we're also innovating as we're going through these processes and integrating those newer technologies into all of our schools across the state. So one thing I do want to share quickly is your question was, how did this even get started? It took a lot of buy-in. And Sabrina and I went across the state. We met with all of our stakeholders. We created a steering committee where we had representation from all of the areas across the state. So from our rural areas, from our urban areas, from our suburban areas. We included community colleges and universities. We included private schools and historically Black colleges and universities, so that we had equal representation or equitable representation across the state to sit on our steering committee. So those were very instrumental things that happened in the first 3 years. In 2020, we got a re-up for additional funds to go from 2020 to 2025. And so we called it MCSRC 2.0. And I'm very, very proud to say that in January, we submitted another grant for MCSRC 3.0.
All right. Thank you, Monique, for that very thorough overview. And like you said, you are one of the only states that receives that funding to support your simulation consortium. If only all the states had that same opportunity.
Yeah.
So that is wonderful. Sabrina, I know that, again, you were very instrumental in getting this consortium started. Can you tell me a little bit about the initial steps that you took? Because it sounds like there was a needs assessment that was done first in order to kind of progress this project. Can you tell us a little bit about that?
Sure, Kelly, that's a really good question. And I think it's helpful for those who will listen to this podcast in trying to start their own consortium. What are the real details that you need to do in order to, funding, of course, is prime. I mean, you need funding in order to get it started. But after that, because we had the funding, our first task was to do a needs assessment of the state and figure out what is it that they needed for education. I think what's important going out to each one of those schools was not just say what we can do for you, but what do you need from us, so that we understood their needs. And once we collected all that data and all that information, we took that and developed this curriculum model for the state. We realized that one size did not fit all, that we needed to have these 3 levels that Monique talked about, so that we knew we had a novice level, we had a competent level, and then we tried to move everybody up to a leadership/expert level. So that was kind of the trajectory and the thought. Now, to measure that, back in 2015, we did not have any needs assessment, formal evidence-based needs assessment in order to do that. So we developed a tool called the PASS tool. So that stands for Program Assessment Survey for Simulation. We used all the standards. We used the standards from accreditation, the ANACSL standards, now the healthcare simulation standards. And we use, at the time in 2015, the National Council came out with their guidelines for simulation programs. So we put all of that together and then sent it out to simulation experts like Pam Jeffries, Susie Cardon-Egrin, to just give content validity. We had to do this so quickly in order to have a train the trainer program. So we did this in the late fall, finished it in January, put the curriculum together, and then had to, and then our charge was to have in the spring was to have the first train the trainer program, which we did. And those were kind of those initial steps. Really important was that needs assessment, so that we weren't just providing education to people who say the more competent individual. We weren't giving them the basics. And I think that was key and important to the first step. When we went out, in order to do the needs assessment, we interviewed all of the simulation coordinators, simulation directors of all of the programs. So we wanted to have the right person who had knowledge of simulation in each institution. And we were nurse-centric. So I think as others look to start programs, they first have to decide, is it going to be nurse-centric? Is it going to be interprofessional? And what is it that you want? What's the purpose? And the purpose of ours was really in the end, was to provide equitable simulation education and equipment to all of the programs. So very forward thinking as far as providing that to for the state of Maryland for the undergraduate programs. We did add a few graduate NP programs as we moved on and moved forward. And Jaslyn will talk about how she broadened it out further past nursing centric. But I think in starting consortiums, they probably need to know their real purpose. Is it just to do a conference every year? Is it to do professional development? So they just need to make that decision. We did also, which I'm really happy to say, we did an evaluation plan, which made a big difference for us those first few years. We had goals, indicators, who was going to measure, what was going to be measured, and then we were able to see what kind of impact we would have within the state. So that's kind of how we started in a nutshell. And I'll let Jaslyn speak a little bit more to how we moved forward from those very beginning stages.
Thank you, Sabrina. So I'll add on. I think the key, like Sabrina had mentioned, is continuously having assessment of what our learners need. I think that's one reason we're able to sustain and continue to grow. I just, am starting to plan for this spring cohort, and we had over 80 applicants and 75 are going to be participating. So to have those numbers 10 years out really talks about our ability to sustain the program. And I think key pieces of that, like during the pandemic, we realized we couldn't have in-person training. So we pivoted quickly and adopted some hybrid models that continues to be very popular with our audiences because we're spread out across the state. I think that really has helped grow our program and sustain it. We also realized early on that, although we're nursing centric, we lean heavily on our simulation operations specialists to continue to, grow simulation within the programs. So we've offered some training for that population and then really tried to build a community of practice. That's, something that might have not been the biggest intention early on, but now it's always on the forefront is how do we build this community of practice for our educators? Because although simulation is growing, there's still that feeling where you're the lone wolf, right? Mm-hmm. Many times at your institution, you have a few lone wolves at your institution. And so we have expanded. So we've created open forums. I just got off one earlier today where people just come together and share wins, share challenges, innovation, and it really keeps us connected. I see some of the same faces over and over, and it's fabulous. We do our journal clubs, which Sabrina initiated, and I'm continuing to do that. And now we have folks who have gone through Cell 4 who are publishing, and we get to have them as our guests and feature their article, which is amazing. We've implemented, I think, Monique, this was one of your ideas, sim directors coming together once a semester in person so that we can have some really open dialogue and talk about where we're going as a state. So we've been able to really create this community within our state of simulationists who have the same passion, who have enough opportunity to have dialogue and really innovate together. We expanded our curriculum. Initially, it was Cell 1 through Cell 3. We've added Cell 4, which is all about innovation. And it's a year-long journey where they kind of collaborate with each other across the state from different programs. And, great things are coming out of that. So that's some of the examples of how we've been able to sustain and grow our entity here.
Wow, that is a lot of moving pieces. You got a book club and training. So I guess the question is for a state or an area that's trying to start out and start their own, simulation consortium. Are there any resources, toolkits, or any reference for them? What would you recommend the best tools for them to get started?
So I think the first place to start probably are at standards, just to see what the standards are. We now have a professional development standard, did not have one until this recent iteration of the healthcare simulation standards of best practice. So I think starting there to see what is professional development, what is expected, what do the standards say. There's so many resources. There's the standards, there's accreditation standards. Even if you're not going for accreditation, you can look at those standards. The same for the CHESI. That kind of brings me back a little bit because I don't know if we still do that, but we were paying for individuals who sat for the CHESI, and if they were successful, they were reimbursed for being successful, for achieving that. I don't know if we're going any further with the CHESI A. We may be, I imagine, in the future, but and I'll let Jaslyn talk about that if in fact you're moving in that direction. So there's a lot of resources. All of your simulation associations like NAXL as well as SSH. So there's several places for them to resources to search for.
Is there anything specific about starting a simulation consortium? The steps to kind of creating one, things that they should be thinking about, things to include?
I was going to say we're going to have a collaboration across the country for people who had started consortiums. Mm-hmm. And I think Katie Waxman has done that in California. So she would be really a helpful person to talk to because they've gone from their state all the way to other states on the West Coast. So that would be person just looking for individuals. And again, the purpose, what is the purpose? Mississippi has a consortium. So that would be a place to start. Tennessee has one. And again, a lot of it, sometimes it just depends on their purpose and how much they want to do and what their funding is. We've been able to do so much in our state.
Absolutely.
And so one other thing that just to dovetail on what Sabrina's sharing, we already had affinity groups in our state. So the pre-licensure programs for our deans and directors, we meet quarterly. And then for our associate degree programs, all of those directors meet monthly. So we had an infrastructure in place where we already had some commonality and we were already having conversation and having people together. But the big key that I was most proud of, and when we were getting this together, was how we built our steering committee. That steering committee, even though we were looking at the state as a whole and looking at this large elephant that we needed to take one bite at a time, we were able to build that steering committee. And as Sabrina shared, looking what your goals are, how is this consortium going to benefit us all? And what's the buy-in or the what's in it for each of the individual institutions? And so when they saw the training was a benefit and then the equipment and the materials was a benefit, there was not a hard road to get that buy-in. But once they were on site and had to get the education, the other piece of it for me was the continued evaluation of the programs that we offered so that we could continue to make those improvements. So from year 1 through now year 15, we've been able to build on this great idea because we have had that ongoing evaluation.
Excellent. And like you've just demonstrated, you're more than just providing a training for simulationists. You're doing so much more. You're providing resources and equipment and not just a one and done type of training. You're actually helping individuals to advance their simulation training through all these different levels. So one question I have for you is, what's been your impact as the MCSRC? I'm getting better. What has been your impact, not only for the community colleges, for the simulation field, but just in general?
So I can speak a little bit to that because during my reign, when I was there, we did evaluate based upon that evaluation plan, we did evaluate somewhat a little bit kind of high level as far as what were they implementing within their programs. And what we found was that they had started to have theory-based debriefing methods. They were using a theory to underpin their simulation program. And if you look at Kirkpatrick's levels of evaluation, we looked kind of far out at that level 4 to see if we had an impact on NCLEX. And the data that I had collected found that 70% of the schools that were involved in the MCSRC. Now I know there's other pieces of NCLEX success besides the MCSRC, but 70% of those schools did improve their NCLEX scores that were involved in the MCSRC. So I think that's a pretty big impact, because the purpose of the funding is to increase the number of graduates and to increase the number of faculty, so that in the end, we increase the workforce. And if we can do that, and we can show that, through, them being successful in only one attribute, but, successful in NCLEX, then we know that we have increased the number of nurses who are graduating.
Excellent. Thank you for sharing it. Jasmine, you look like you wanted to make a comment.
Yeah, thank you for starting us off, Sabrina, with that. So I actually am in my PhD program, the scores tool developed by Dr. Kim Layton and her team, and just got my data analysis, and I'm kind of reviewing that. So I'm living in that, data right now. And what I saw across the state is that most people are mostly ready to adopt simulation. And I think that's because of the work that we've done. I don't think that back when MCSRC was initiated, so we never really had that opportunity to look at that big level. And this kind of let me know that we've really made an impact here. Everyone from administrators to sim team faculty to sim technicians or to clinical instructors, the average response was that they're mostly ready. So that really shows that they have been exposed to simulation. They feel like they're ready. They have the resources ready to adopt. So that was one big thing. And then I just feel more people are open to innovation. I was talking to Monique earlier in the semester, and she was talking about, I'm not going to use the word change anymore. It's going to be innovation. Am I quoting you right, Monique? And I think folks are open now. I think they see it as a good thing. And they're not, we know that adoption of any type of new technology, takes time, and it's a very slow process. But I think we're making some progress there with our folks because we've done so much with them over the past 10 years. So now they're almost like, well, what's next?
I was going to say that's a perfect segue to my next question, which is, what is the vision and the future for MCSRC? You've done such a great job with everything that you've been doing this past over a decade. What's next?
So I want to start by saying it's just been a pleasure for all of us to work together and to have the buy-in from the stakeholders. And it's not just our faculty and staff at our institutions, it's our hospital partners as well. Many of our hospitals have simulation centers, so they're able to send their staff for training with us. And all of this, all of the hospitals in the state of Maryland have nurse residency programs. So that's another area where we have a consortium. So I think it has been extremely beneficial for us to say, okay, these are the impacts that we've made in the past. Now, where are we going next? So last year, we had some overage in our budget, and they never want us to send grant money back. So they would like for you to spend it. And Sabrina mentioned how we were covering the cost to reimburse people for their CHESI, but we were also able to give them a flat out stipend for receiving the CHESI. And I believe we gave them, I think, $1,500, Jaslyn. So that was like a huge award. So not only did your CHESI get paid for, but then you got just a stipend because we were super proud of your success. And so when you have projects and people are doing really well with their work that they're doing. You want to reward them. So we advocated in the future to increase the honoraria. So the faculty received $200 for coming to participate in the training. So the training for them is free, and then they were compensated for their time in coming. And we advocated to increase from $200 to $600 for their time. So that's just one thing that we've done to move forward in the future. Integrating the immersive virtual reality is a huge piece of the puzzle. So in our 3.0 version of the grant, we have additional funds built in for equipment replacement for the goggles as well as the software. And then we've integrated additional training and support for not just the nurses, but the nurses who are working in the technician type of roles. Jaslyn, do you want to talk a little bit more about the OSTEs?
Yeah. So, for the past 10 years, we've done a lot of education, and we have over 400 educators in the state of Maryland who've gone through MCSRC training. So I felt like the next thing would be evaluation. We need to bring them back and kind of do some type of evaluation. So I've done a lot of research and work in OSTEs, objective structured teaching encounters, which are being used in medical education to train educators in this role. So I would love that's our next big project that we're going to be embracing over the next 5 years, is building OSTEs and then bringing our educators back either virtually or live to go through them and then see where their gaps are. And that might require additional curriculum. We might realize we need a refresher because folks went through in 2015. So I think that's going to really help provide us with the information in terms of how we move forward. So I'm really excited about OSTEs. I'm looking at, if we could have the expertise with AI exploding right now, AI generated learners, and do it, virtually, because logistics is always challenging to bring people back. So we're exploring that. I did have an opportunity to pilot an OSTE within MCSRC last semester, and it went very well. We also talked about really building an endorsement for our programs within Maryland. SSH accreditation is there, which is sometimes a lofty goal. So we're looking at INAXL's endorsement program, and can we really help champion our programs to be able to go through that process and help supplement in terms of finances and support them through it. So I think over the next 5 years, that'd be exciting to really get our programs through that endorsement through INAXL, and then maybe get them ready for accreditation. So those are some of the big things in addition to the VR that we're looking at for the next 5 years.
Wow.
And you left off one more important thing.
Go ahead, Monique.
We want to offer some training for the schools as they're starting to build their standardized patient pools. So, so we may not be able to supply them with funding to support hiring standardized patients, but we do want to offer a curriculum and a framework by which, if a school wants to start out creating their own standardized patient pool, that they'll have guidance and support to do that.
Oh my goodness. We have run
so
out of time, but I feel like we can go on and on and on. I just want to say congratulations. You have a very successful simulation consortium that I hope that other states have the opportunity to duplicate. And I'm even amazed at some of the new projects that you have coming up. We'll have to invite you back for another podcast for the OSTEs because we want to hear more about that. But I want to take this moment just to thank you. Thank you for sharing all this information about your wonderful consortium. Hopefully this will be very helpful to others who may be just starting out, who are thinking about starting their own consortium, because you really are a model and an excellent example of what can be done with a simulation consortium. So thank you, Sabrina, Jaslyn, and Monique, for taking the time out of your busy schedules to come on to this podcast. We greatly appreciate everything that you shared with us.
Thank you, Kelly, for having us.